My humble salutations. My name is Dr. Shaji. I born and brought up from Kerala. I went for my Ayurvedic studies to Chennai. 1992 I passed out from Venkatramana. 1992 I passed out from Venkatramana Ayurveda College. Currently I am practicing in Ananagar, Chennai. I will just draw some charts in your hand to feel the pulse. My duty in this is to teach you the exact pressure to apply, and I will do it personally. Pulse diagnosis cannot be taught as theoretical part. It is 100% practical now. There are 5 types of pulse basically. There are 2 methods of pulse diagnosis. One is Vata-Pitta diagnosis, another is organ by organ. As per spiritual anatomy, body has got 3 knots. These knots are not there in the physical body, but it is there in the subtle body. The perfect harmony of the form and formless only we are going to read from Atmanari. How to hold the pulse correctly? Hold it like this. Okay, like this. You have to hold it like this. And then because this is the seat of Atmanadi. Then like this. Is it clear now? Yes.
Dr. Shaji, in your estimation, can we use either wrist?
For the diagnosis?
For the diagnosis.
Yes.
Okay.
For organ diagnosis, no. It's different. For Vata-Pitta diagnosis, you can use both hands. And there is no restriction that after food and all, no, it's nothing like that.
Can there be any difference if we use the right hand for male or
See, in the traditional thing, what they used to tell me is for male, you have to check the right, but in female, you have to check the left. But practical part, I have not found any much variation in that.
in case if the one hand is injured?
You can check the other one.
In the traditional way, male is the right?
The right side will be strong. The prana flow will be on the right side more. For females, it's in the left side.
It's not compulsory to check right or left. Means both hands.
For organ diagnosis, it is there. For organ. See, this is the channel called Amrutakala. Once when the moon goes from full moon to the new moon, that 14 days corresponds to 14 goddesses. Same way from new moon phase to the full moon also 14 days are there, Tidis. So that corresponds to one goddesses like that. That is what Nitya Devi, the offering for that. It's a very, very important channel. Important channel means that's the channel through how the flow of prana is measured. I can tell like that. In Siddha means not the Siddha medicine, the Siddha tradition. There is a saying like this, Amrudotam Terinjavan Siddhar. That means who knows the flow of Amrudota, he is called as a Siddhar. So when you do Shiravasti, you read the pulse. Okay, you can see in one hand the pulse rate will go up, the other hand the pulse rate will go down. Then after a particular time it will come like this. This side it will go up, this side it will go down. Then it will be regulated like this. That time you have to take out the cap. Okay, that's the right way. So this Shiravasti and all other things can be work under the principle of Amrutakala. There is a life in you. Like whatever life force or whatever it is, what we call as jiva, that is warm, but your body which surrounds the life, that should be always cold. Okay, the technique behind the treatment is, if your body is getting warmed up, you make it cold. If your body is cold, make it warm. That is a treatment technique. Is it clear? So the same phenomena is applicable here also. One will make your body hot, this will make your body cold. That is controlled by the central channel, Sushmana. You know what is the difference between a physician who knows pulse diagnosis and who knows normal Ayurvedic thing. Now coming to the medical side. For a normal doctor, a patient will be coming and he will be telling, doctor, I have pain, I have that problem, this problem, everything. That is whatever it's happening on the gross body. Clear? So you will be giving a prescription, this kashaya, that kashaya, the sahajaradi kashaya, dhanandaram kashayam, ashtavargam kashayam, lot of combinations. But a physician who knows the secret of pulse, he won't ask you, what is your problem? He will just hold the pulse and he will tell you the problem. It is like this, this, this. So your body is made with a form and a formless. Right? There is a form called Dr. Biju. But there is a formless which drives Dr. Biju. The perfect harmony of this form and formless is a healthy state. If there is a disease for you mentally as well as physically, you will be irritated, you will be agitated also, because there is an imbalance of the form and formless. So for this, normal doctors will treat the form, because the patient will give them the feedback. I have that problem, this problem. But a doctor who knows the pulse diagnosis, he will treat the formless. If the formless is set right, what will happen for the form?
The balance.
It naturally falls into the harmony. Now we are going the practical side of pulse diagnosis. This is Vata, this is Pitta, this is Kapha. You just draw. So now we learned how to hold pulse. So from morning 6 am to 10 am, this is the normal state of pulse. From 6 to 10, which dosha will be activated? Logic, don't see that. Which will be the dosha? Correct. So that is why 1. So if this is 1, this should be half, this should be quarter. What is this 1? Any idea? 1 is that spike. Spike means matra. That spike is like this should be half. That should be just quarter. So Dr. Biju, this is Kapha, this is Pitta, this is Vata. The maximum spike should be on this.
But does that change as I as I change the pressure of the finger?
No, it will change like this. Wait. Can you make out the difference now?
Okay.
Everything has changed.
Yes.
Now you just release this. What happened now?
It changed again.
Again changed. Now you hold it here. Just give the pressure here fully. What about now?
Okay, I see the big difference.
Big difference. Now you see, Dr. Biju, this is more pressure.
That's too much pressure.
Yes, you should not give more pressure. Just keep it like that. Hold it. Give pressure in this. Give pressure in this. Sorry. You have to hold it like this. Prakriti, Dr. Biju.
I think this is very poor prognosis. It almost indicates that the person is imminently going to die.
Die. It is one of the Arishta Lakshana, because Kabha is blocking the channels, Ama is blocking the channels. Okay, one of the Arishta Lakshana, but I have treated such patients also. This is whatever the 3 slides, what we have learned. Okay, with where the time has been indicated. That is the Sahaja, normal state of pulse. Clear? So then what is Vikriti? Dr. Biju, you should listen.
Yeah.
Then what is Vikriti?
Kapha
1 second, come. You are right. No, I need the book. I need the book also. I need the book. So what is Vikriti? You hold anybody. Anybody's pulse. This is very, very important. Which is 1?
Right now
Pitta is 1.
then Vadam, then Kapha.
Vada is half.
Half. Then only Kapha.
Kapha is 1/4. Okay. So do you have any gastric problems?
Sometimes.
Understand. What is the time now?
10:45.
10:45. What is the normal? What should be the normal state of pulse at this time?
Vadam
1 second. Vada?
1.
Vada should be 1.
Yes.
No. This is a merging time. It's a merging time. Pitta should be 1. This should be
Half.
half. This should be 1/4. Okay. But this that is same. But this is Vikriti. Vikriti because Pitta should not come this much in this time. After 11 o'clock or after 12, it can. Okay. Body is having hot. So what is the treatment should be given for this? Cooling. Understand? This is equalizing the doshas. Another thing is there. Do you have constipation? Will you go to toilet twice a day? Because there is dryness in large intestine. Okay, this is organ diagnosis. And often used to get cold, cough, sinus, throat infection. Once in 3 months.
എപ്പോഴും ശ്രദ്ധിച്ച് നടക്കണോണ്ടായിരിക്കാൻ ചിലപ്പോൾ ഇല്ല.
And you eat very fast because Agni is Vishama, Vishamagni. That is why this is one. And this is the spleens energy. You have pain somewhere in your body. This is organ diagnosis. But there is another science also in this. You can predict which organ is going to give failure. Okay, this organ will give problem in future. So take care of that. See, one of the this end. Madam, you are not taking water sufficiently. How much liters of water you will take in a day?
ലിറ്ററൊന്നുമില്ല കിട്ടുന്നത്
Approximately.
6 glass.
Not even one liter. This, if she is, because the kidney and urinary tract is dry, if she is not taking sufficient amount of water, the large intestine will show dryness. Understand? So you can go for those type of diagnosis. Okay, that is the beauty of organ diagnosis. But whatever the thing, if the organ is malefic or if the organ is plus or minus, whatever it is, you equalize these doshas. That is why what explained by the acharyas, whatever the disease may be, you equalize the doshas. So you make the combinations. So this combination, whatever the combination you give, that will affect the organ. Which organ? You can increase the flow of prana to that organ so that you can protect that patient's life from the future. This is kapha. Okay. So you should get a spike where kapha and pitta meets here in cervical spondylosis.